Hi, I'm Kattya,
Hello, my name is Kattya.
and we're going to talk about aspirin, specific and going in depth into salicylate toxicity. All right, so for name and category, the generic name for aspirin is in fact aspirin, or well, acetylsalicylic acid. Its pharmacological class is a nonsteroidal anti-inflammatory drug, or in short, an NSAID. Its therapeutic class is a non-opiate analgesic, which is to manage pain, an antipyretic, which is to manage fever, and an antiplatelet, which is, well, to prevent platelet formation. And its brand names are Ascriptin, Aspergum, Aspartab, Bayer, as in the picture, Aspirin, Ocotrin, which is another one in the picture, Icperin, and Entrecot. And as for some of the other medications, these are all listed below, and these are all under the same group, which is the salicylate group, which aspirin happens to be found in. Okay, so expected pharmacological actions. It's a group of medications known as salicylates, and these are responsible for stopping the production of platelet aggregation by inhibiting cyclooxygenase, which is COX-1. All right, so for therapeutic use, as a COX-1, it's responsible for inhibiting the aggregation of platelets, which in turn kind of helps prevent strokes, most of these being ischemic or transient ischemic strokes. Both of these are both caused by clots in the brain, which when given aspirin, it helps to dilute the clot a little bit and helps it to get removed from or dislodged from the vein, or the artery in this case. It also helps with reducing inflammation and treating mild to moderate pain. It helps reduce fever as an antipyretic, and it also helps in lowering the risk of heart attacks in patients with cardiovascular conditions. These conditions can range from chronic coronary artery disease, which is CAD, and angina, which is basically chest pain. So for administration, they can come in extended release pills, which is just to swallow it whole and not to crush, break, or chew, unless they're scored, but that's another story. They're available in these dosages. It just depends on what the doctor recommends for the patient. The most common is the low dose aspirin, which is 81 milligrams for prophylaxis, which is when it helps to treat heart disease. The patient should stop taking it a week before any surgery, and they should not take 6 weeks after the varicella virus vaccine. Okay, so some adverse reactions to this drug can be gastric upset, heartburn, nausea, gastric ulcerations, bleeding, which is shown through dark stools or bloody emesis, kidney dysfunction, salicylism, Reyes syndrome, which is swelling in the liver and the brain, autotoxicity, diaphoresis, hepatotoxicity, hypoglycemia, and granulocytosis, which is destruction of white blood cells.
So when it comes to pregnancy, be careful when using aspirin because it has an increased risk of complications to the mother and the baby. It can cause the severe illness, or baby might die. So avoid using aspirin when pregnant. It can also cause excessive bleeding during pregnancy, labor, and delivery. Some nursing interventions would be do not give this to children or adolescents. Could cause Reyes syndrome, which is very rare. Monitor for bleeding, such as bruising, or if you have a cut or any injury that causes you to bleed out because platelets are like not clotting and you can bleed out. GI bleeding, black or dark colored stools, vomiting, blood. It's recommended for proton pump inhibitors because it reduces stomach acid. You want to monitor for intake and output like bun and creatinine, signs of MI, or any cardio issues, and any signs and symptoms of adverse side effects or toxicity.
Alright, so for client instructions, it's recommended that they take with food, milk, or at least an 8 ounce of glass of water to help reduce the GI effects. It is also important that the patient the patient should report any signs of bleeding and as well as any signs of fluid retention, which could include weight gain, edema, or even bloating. They should also report any of the adverse side effects, and they should stop taking aspirin if these in fact do occur, these adverse side effects. And they should also avoid alcohol since these would just aggravate the GI symptoms and make them just worse for the patient and overall.
Some indications would be allergies, energetic. We know that it can cause pregnancy issues and death to the baby. Asthma, stomach ulcers, kidney disease, liver disease, bleeding disorders. Do not give this to children or adolescents, especially if they're under the age of 18. Surgery, alcohol, and hemorrhagic strokes because you can bleed out.
All right, so for precautions, don't use aspirin if you happen to be allergic to it or to some of the other similar drugs in the salicylate group. Aspirin can in fact interfere with blood clotting and can increase the risk of bleeding. Drink less alcohol or just don't drink any at all if you're taking aspirin to help reduce the gastrointestinal bleeding or any liver damage. Aspirin has in fact been linked with Reyes syndrome, which is swelling of the liver and the brain, so use with caution when giving it to children or teenagers or just to treat fever or pain. And these are some of the interactions. Some of the most common are with activated charcoal, which helps to decrease the absorption of salicylate. Anticoagulants such as thrombolytics, which in turn kind of increase the risk of bleeding. Corticosteroids, which increase the salicylate excretion and decrease the blood level. And furosemide, which increases the risk of Reyes syndrome. All right. So for toxicity, there happens to be two types. One is acute, which is a large amount at a single time, and chronic, which means that it takes much longer within that time period just for the toxicity to occur. And it tends to happen with ingestion, which is greater than 150 milligrams per kilogram. The symptoms happen to be nausea and vomiting, abdominal pain, dizziness, sweating, rapid breathing, confusion, deafness, hallucinations, seizures, coma, and dehydration. And these symptoms tend to happen between 4 to 12 minutes after acute ingestion. In terms of mechanism, at high doses, aspirin does disrupt the normal production of ATP, which kind of causes it to go into anaerobic respiration, which as a result tends to produce high amounts of lactic acid as waste, which can eventually lead to metabolic acidosis, meaning that the body has too much acid in it, which can, as a result, lead to organ dysfunction and even death if it's not treated in time. If it is treated in time, though, you can do so by inducing vomiting into the patient if the ingestion was in fact recent. You could also do so by pumping their stomach, which is known as gastric lavage, or you could even help with activated charcoal to help absorb aspirin from the body. You would have to monitor their vital signs, which is their heart rate, their blood pressure, and their temperature. You would have to do intravenous fluids to help maintain hydration, provide with supplemental oxygen, especially because the patient is going to have difficulty breathing, administer through the intravenous method some sodium bicarbonate to help correct the acidity in the body. And lastly, you would help with to regulate the blood levels. You would provide glucose supplements. And these are our references. Hopefully this was helpful for anybody who is looking into taking aspirin. And we just want to thank you for listening to us. Have a good rest of your day.